Today we're back at it reviewing your favorite webcomic Cyanide and Happiness for the second time. We're going to be learning about and breaking down some of the crazy medical type situations and injuries that happen in the dark comedy show.
It's the craziest thing, Doc.
And out.
I put a mouse up my ass. You know, when I kind of feels good.
Oh my gosh. Surprisingly, people come to the emergency department often enough to have a conversation where things go up there and for whatever reason, they don't appropriately think about trying to get it out after.
So I sent my cat in after him. So an hour goes by and my cat's still up there. And I start to get worried. I mean, one more dead mouse.
I love how the doctor just ignores him after he says that comment.
Left shoulder.
So I offered to take my neighbor's dog for a walk.
And once more over my right shoulder.
So I put a few slices of ham and some spicy mustard on the old bee-hole, and sure as shooting, he took the bait. I was hoping the dog would like cause a ruckus and scare my cat into coming out. No such luck.
So somebody comes in with a foreign body in their rectum. We get an x-ray, see what it is, make sure we're not blindly sticking our fingers in there. It could be sharp, it could have a needle, and we don't want to poke ourselves. We want to, as ER doctors, try to get it out ourselves first, because if we don't, you have to go to the operating room.
Which makes me worry about the chicks I put up there earlier. I mean the baby chickens, not the 3 hot girls.
So what seems to be the problem?
Oh, I got a little tickle in my throat.
Here's a prescription for some cough drops.
Thanks, Doc.
You can have a doctor do an endoscopy, a sigmoidoscopy, sometimes colonoscopy, and then sometimes literally you just have to be knocked out so they can actually stick their, not just a finger, but like a hand in your rectum to be able to grab whatever's in there. And then worst case scenario, you have to be opened up from the front side.
You ever wonder why men have nipples?
It is actually an interesting topic to be brought up. Why do men have nipples? There could be hormonal imbalances or related to cancers that can have a male potentially lactate. It also has to do genetically in our chromosomes, having to do with specific ducts that get turned on, off.
Like, they don't produce milk. At least, I don't think they do. I guess men can lactate from hormone imbalances or whatever. And they're definitely not, like, evolutionarily advantageous. You know, like sexual selection? Like, no one's attracted to that. Chest, maybe, but not the nips. And male animals have nipples, too.
Dogs have
Oh my god. Men go through puberty. There is some structural changes that occur, and that has to do with hormonal changes.
Hey, are you even listening?
Nipples are not speaker volume knobs.
We need a medic here, stat! Oh, hold on, sir! No, don't move! You were in a terrible car accident! You're at the hospital!
Need some help over here.
It's really good. You get confused, you might get combative because you don't know what's going on. Your brain's been a little knocked around in the sense that it's had trauma potentially. So it's good that the paramedics are trying to kind of reorient. I know it's a show, you can have a seat collar on to protect the cervical spinal area so that you don't get further injury if there's a fracture.
All right, coming through!
IV is open. How's his pulse? Blood pressure? 85/40. Pulse is 120 and steady. Possible hypotension.
Oh my gosh, so these are actually really good. Get fluids going because the patient's hypotensive and tachycardic. So blood pressure low, heart rate up. That's basically a sign of hemorrhagic shock.
I'm here. Let's save this man's life.
If you're doing a sterile procedure, then you'd actually need sterile gloves. But even then, there's techniques to put them on yourself.
Oh, thank you, doctor. All better. Oh boy, you saved my life. Good job. I'm
Oh! What was that? It's hard to tell, but I'm assuming it's part of intestine and maybe stomach. You have your rectum to your large intestine. We're going backwards. Then your small intestine up to your stomach. Probably a stomach that just came out somehow. That needs to be put back together.
We couldn't find any more IV tubes, but we did find these crazy straws from the cafeteria.
Same thing in hospitals. You can actually run out of supplies related to IV tubing, IV needles. Manufacturers aren't keeping up with the demand and there's no supply.
That crazy straw idea just might be crazy enough to work.
In this case, you have to do some sort of MacGyver movements. MacGyver meaning like coming up creatively with a way to deliver what you need to deliver to the patient.
Live, damn you!
Oh, it's not gonna make it.
It'll make it.
Here comes a loop! Oh, God!
Holy shit, it did it!
Look at it go!
Oh, baby, yeah!
Oh my gosh.
Go, 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 go!
Yeah, no. The straws obviously are not sterile, so that would be your first thing. And then, could it actually work? Maybe. I think you'd probably have to tape the seals.
Yeah, he's been dead for a few minutes.
Now, if a patient can actually take fluid by mouth, it's actually better than getting it intravenously, just because you absorb it better into your body and stays in based on volume. I don't think fluids was going to save the person's life. Now, you gotta do CPR and then see if there's a shockable rhythm. Oh, wait a minute. Okay, real university, real doctor MD, a real doctor. There are a lot of doctors out there that actually even have medical practices that aren't supposed to be practicing medicine. If you ever have a concern about your doctor, there is the National Practitioner Database. You can look up a doctor. You can pretty much find it anywhere you want versus a certificate on the wall.
I should know. I'm a real doctor.
Oh my gosh.
This is the police!
Uh-oh.
Open up! We have a warrant for the arrest of Dr. Lionel Real Doctor on 6 counts of medical malpractice.
The police wouldn't just barge in that moment. We get police officers that come into the hospitals every now and then. Most of the time in the emergency department, we get it when they either bring somebody who's in custody and need medical clearance, a DUI, or even like traumas, gunshots, stabbings. Those are all reported to the police and they need to come to the hospital and start their investigation there.
All right, Dr. Real Doctor, if that is your real name, you're under a...
Not there.
Don't say a f***ing word.
Come on. Hospitals, though, do vet the doctors. Basically a process where they do background check, all this stuff, make sure your credentials are appropriate, and make sure that you don't have any kind of shady background.
Well, Mr. Watson, we have your lab results back, and well, you've got norovirus, hepatitis, tendinitis, syphilis, salmonella, sickle cell, a rash. We don't know what it is. A toxoplasma, super asthma. Better go call Make-A-Wish. You haven't got much longer, and I haven't finished half my list.
Holy cow, a ton of diseases and infections and different processes. There's a lot going on there. So you got norovirus. So norovirus causes like diarrhea. You got hepatitis, which deals with your liver. It can be A, B, C, D, and E. There's 5 different kinds. Tendinitis, so you have inflammation of your tendons. Syphilis is a sexually transmitted disease that causes a painless ulcer.
Your poop is filled with lupus, all your shit is out of whack. Your heart's diseased and full of bees. A single breeze could end your measly life. And also measles, measles, fecal beetles, fetal alcoholic syndrome, chronic symptoms common to medieval people. Your nose explode, your back is stone, your cells have unknown chromosomes.
Wow. Okay. If I go over every single thing that this doc is talking about, we'll be here for weeks. This is amazing. We're talking about lupus. We're talking about issues controlling your urination. It's just, the list goes on and on. I just don't know where to even begin when it comes to this stuff.
And kidney stones and loads of Crohn's and toenail cheese and pubic fleas and leaky knees and athlete's foot and truckers, but one twisted nut you'll never see. With any luck, you'll kick the bucket soon enough. Also, you're deaf.
I didn't read all the way to the end that the patient is deaf. The American Sign Language we have at the hospitals for people to use if they're deaf. Sometimes family members come in, but we do have options for people who are deaf. In this case, you could also write things down or give a piece of paper with a diagnosis and go over things that way. That was very intense. Cyanide and Happiness, hilarious from a medical standpoint. Like, the creators of this did a really good job. I love it. So much always to dissect related to this. I really enjoyed this. I want to do more. Let me know any scenes, episodes that I need to check out. And if you guys like this video, I know you're gonna love this video. As always, subscribe, like, turn on your notifications. Thank you so much for watching and stay healthy, my friends.